Doctor, thanks for tuning in today. Let's talk about something that's rapidly changing the landscape of thyroid medicine genetic testing. Specifically, the Thyroid Genetic Disease Risk Panel. This isn't just another lab test. It's a clinically actionable tool that screens for pathogenic variants in 46 genes tied to hereditary thyroid conditions. We're talking congenital hypothyroidism, thyroid hormone resistance, autoimmune thyroiditis, thyroid cancer, and even familial goiter syndromes. Now, why does this matter for your practice? Because traditional thyroid labs, TSH, T4 antibodies, can only tell you so much, and often they don't flag anything until the disease is well underway. When you see a patient with unexplained thyroid dysfunction, early onset disease, or a strong family history, this test can reveal the underlying genetic cause, often before symptoms spiral or traditional labs catch up. But let's go a layer deeper. Each patient's metabolic profile is unique, shaped by their genes. The thyroid is the master regulator of metabolism. But what happens when the genes controlling hormone synthesis, receptor function, or iodine transport, like TSHR, TARB, DUOX2, or PAX8, don't work as expected? You can't spot this just by looking or with a basic lab panel. Genetics bridges that gap, showing you a patient's true metabolic capacity and even predicting how they might respond to levothyroxine, anti-thyroid drugs, or their risk for thyroid cancers. So how does this panel change your day-to-day? First, it personalizes care. Detecting a likely pathogenic variant can justify early intervention, more frequent surveillance, or even a shift in pharmacologic strategy, especially for hormone-resistant or subclinical cases. Second, it clarifies diagnostic uncertainty. When you have a patient whose symptoms mimic multiple thyroid disorders, fatigue, weight swings, mood changes, this test can cut through the noise with objective genomic clarity. And third, it helps with risk stratification and family counseling. If you uncover a familial syndrome, you can advise relatives on screening and preventive care, turning one diagnosis into proactive family health. Now, you might be wondering, is this just a nice-to-have test, or is it medically necessary? The answer is clear. This panel is appropriate for pre-symptomatic screening in patients with family history, diagnostic clarification in chronic or congenital thyroid issues, therapy selection for suspected hormone resistance, and surveillance planning for those with genetic risk of thyroid cancer. It's not a wellness test. It's a medically necessary tool that can be reimbursed by insurance when properly documented. Let's talk workflow. Start with a new patient evaluation. Use the right CPT codes. Offer genetic counseling if indicated. Collect the specimen, simple buccal swab or saliva, and let the lab handle the testing. Once you have results, schedule a follow-up visit to interpret findings and refine your treatment plan. Don't forget your ICD-10 codes, diagnoses like E03, 9 for hypothyroidism, C73 for thyroid cancer, and Z83.49 for family history of endocrine diseases. Document clinical symptoms, family history, the medical necessity for testing, and how treatment would change based on the outcome. Here's the bottom line. Integrating this genetic panel into your diagnostic workflow means you're not just treating numbers, you're treating the patient, their story, and their future. In a world where millions live with undiagnosed or misdiagnosed thyroid disease, offering clarity, accuracy, and actionable insights isn't just good medicine, it's the gold standard. Thanks for your commitment to precision medicine. Your patients deserve nothing less.